Greetings, boys and girls, ladies and gentlemen. It's Rachel coming at you today from MOAD. We love our entrepreneurs here at MOAD, and again, we have such an exciting interview. It's such an honor, always talking to the highest producing, most productive entrepreneurs. We love telling the story about how they kind of stay perpetually in that zone. How do you get to be somebody who is an authority in their field? How do you become an expert in your trade and to become a market leader doing that? So, on the extreme side of things, we love to tell that story about how, because everybody always thinks that once you step into business for yourself, or you're a doctor, or you're a lawyer, or you have a practice for yourself, that is just something that you had a natural instinct for it or a natural inclination. And that's what XStream is always telling the story of, that it's not a lottery that you win, and it's not that you were born on third base, so to speak. It typically it is because you just never say no. And when life gets you, when life becomes a struggle, as it does, that's what makes us all human. Like, we all face our own challenges, our own unique set of challenges. It's how do you keep muscling through those and barreling through those. So today, the topics that we're going to cover is how to stay in that zone. But I get the pleasure of introducing my guest today, Dr. Shaun Jackson of Consultants in Pain Medicine.
Nice seeing you.
Yes, awesome to have you. So there's so much cool stuff that you do. From you, from you, as little, as short of an opportunity as I've had to know you, in that short time, you're a very, very robust personality from who you are as a person, who you are as a family man, and what you do in the community in San Antonio and the lives of the patients that you impact. So tell us, you start let's start with the practice.
Sure. So it's been a long road, and thank you for giving me the opportunity to come here.
For sure.
To sit with you and kind of talk about what we're doing here in San Antonio, and just excited to be a part of this community and really try to provide a positive impact, right, in the community from a health perspective. I started, I'm from Louisiana, got into the medical school at LSU in Shreveport, Louisiana. When I finished up school there, I decided to go into physical medicine rehabilitation, which is which at that time was fairly new, not very well known. But a lot of the patients that we saw were individuals that had been involved in injuries. It may have been injuries at work or car accidents, medical related diagnoses, strokes, traumatic brain injuries, spinal cord injuries, very significant injuries that cause alterations to those individuals' lifestyles long term and resulted in significant disability. And so the physicians, which are called physiatrists, their primary goal was to help in whatever way they could to restore any form of functionality to those individuals. And so that was kind of the start for me. It was exciting not only just because I'm getting an opportunity to really impact an individual that was really significantly debilitated by an injury, but there is a significant component of other subspecialties within physiatry or physical medicine rehabilitation. So orthopedics, sports medicine, neurology were all things that kind of you're seeing those types of patients. And that's exciting for me from all aspects. I love orthopedics. I was involved in sports throughout my life, and so just being able to participate in that again on a different level on the other side of it was fun as well. So during residency, actually, I was accepted to the UT Health Science Center residency program here in San Antonio. And so when I started the program, it was very exciting, getting opportunities to get on the sidelines at football games, at soccer games, being on the medical staff during those types of events, even participating in marathon events like the Rock and Roll Marathon that we have here to this day, and even participating in Special Olympics that we have here, which is very cool.
So on the Special Olympics side, what do you do with that?
So helping doing physical exams for all of the kids that were participating in those events, and then sitting on the sidelines, monitoring them, making sure in case there are injuries or accidents to be able to assess them and to determine what needs to be done from a triage perspective.
Interesting. So, I've been doing this for years. I've, seen some of the best, and I would say you definitely are in that class of the best. And I always get at some point in time, the goosebumps come out because it's just fun to talk to people like you. Sure. And so on the side of the sports line, and you see these athletes going out there from either Special Olympics, which we know they're some of the most gifted people, right?
Absolutely. absolutely.
From your own personal experience?
Yes.
And I would imagine, you have children?
I do have two.
Are they at all on the field at all?
They're both in sports, both academically inclined and sports inclined. My daughter, she plays basketball, runs track, and does cross country. She's had a little bit of a recent setback with some knee issues that we've been helping her with.
Thank God she's got the best out there, right?
Absolutely, absolutely. And so my son, he plays baseball, and he loves baseball. But we were just made aware, probably about a month or two ago, my wife was made aware by him that apparently soccer is now his love.
There you go.
We both discussed. Is like, you haven't played soccer since you were probably 4 years old, and he's 9, right? So I guess after the baseball season's over, we're going to be looking into soccer.
Well, it's fun. There's a lot of fans out there.
Absolutely.
More than the NFL.
Yes.
A lot more than the NFL. Like 70,000 more, or 70 million more. It's 100 million versus 30 million.
Pretty amazing.
Which I thought was shocking. But aside from that, so my question was this. So you as an entrepreneur, you as a doctor, you as all these things on the wheel of life, father, son, how, and then you go into the office and you see your clients, and you see you're treating athletes. How do you see the difference between being yourself highly motivated to get out there every day? Like, what do you think are the traits and the characteristics of those people, from athletes on the field that you're treating to people such as yourself, to your children?
For me, I think it's finding your love, right? Finding something that you feel connected to, finding something, to some extent that you feel called to do. We talk to my staff, every now and then about, coming to work every day and showing up and, seeing patients and enjoy doing it. We're laughing and talking about our interactions with patients and laughing with patients and having very good interactions that you can remember forever. But it's about finding something that you really enjoy that wakes you up in the morning and say, okay, what am I going to do to make a difference today in someone else's life? And in so doing, it's fulfilling what I like to do. That in itself is going to help you in challenges that come in any type of entrepreneurial whatever you plan to do in life. There are going to be challenges, and there are going to be obstacles. First and foremost, remembering where you started, remembering why you started, and knowing that regardless of what you see in front of you, you have a plan and you have goals that are ahead of you further down the road, and keeping your eyes set on those. That helps. It also obviously helps if you have people in your corner that are able to support you, that give you motivation, that help to remind you that yes, you're gonna fall sometimes, but remember why you started this road, and remember why and what you're planning to do at the end of that road. So I mean, it's very fun. It's very exciting. Like I said, it can be challenging at times, but if you always revert back to the reason why you're doing it, for me, it's the biggest motivation I can ever have.
That's awesome. And so, I like to ask that question because during, the course of this interview, we talk about some stuff that isn't as fun, right? This is the day-to-day of the practice of managing it, managing people, managing yourself, the emotions of it, I'm sure there's days when it's like, throw these papers up in the air and I don't need these anymore, and we'll catch you on the flip side.
Of course.
But I think that's the key when you become highly productive, is that you regulate yourself better than anybody else. The regulation of emotion. So that being said, we were talking about this, that you are broaching the hundreds of thousands of clients. If we do the math and we look at how many treatments, how many clients, how many patients. That's pretty accurate. I didn't put pen to paper, but it seems pretty significant now that you speak the number. Well, even, shoot, 50,000, 60,000, 70,000, when you're treating 100,000 people, when you're impacting those kind of lives. Like as good as that, and as profound as that is, not only on a community basis, but on health and, just improving the quality of each individual's lives. I'm sure there are things that you see, though, that are, also gut-wrenching.
Yes, absolutely.
What's an instance of that?
Well, as a physician and as a provider, as a medical provider in general, obviously our our goal in what we're doing is to provide aid, to help, right? And to provide that medical care that we can to individuals that come to see us and that are treated by us. And for me, the most difficult thing is going through evaluating a patient, going through treatment plans, finding the appropriate treatment for the patient, and just hitting a home run. Just whatever the treatment was that you provide, it's like, wow, that's a grand slam. That individual is going to just kind of blow up. This is going to just be awesome. And so then the individual come back, the patient comes back to you, after the treatment was performed or after the goals were set, and they're unchanged. They're not better. The things that you had set in place and were expecting to see, hoping to see, didn't pan out. And so the individuals are still dealing with the same issues that they started with you with. That's a challenge. That's not only a challenge because the patient is not doing better, but at the same time, in all honesty, it's a little bit of a gut check and a little bit of a hit of the ego, right? Because you've these years of expertise and learning what you do, you're at the top of your trade. The patient walks through the door and you see what their issue is. You plan it out, and they should get better, but they're not. And it's at those instances where you just have to sit back, be open and honest with the patients and with your clients, and say, this is what we planned. This is what we expected. This is not what we are seeing in the result, but we're not giving up. There's still hope. We're going to discuss what all our alternatives are out there, and we're going to continue to push forward. And so that was something that I learned actually when I was in my fellowship training at MD Anderson in Houston.
MD Anderson.
Yeah. That place is amazing. I learned so much from them. Them being the medical providers, all the medical staff, the attending physicians, everyone was succinct in that goal of taking care of the individuals that walk through the front door. And they have this slogan, we make cancer history, right? And it's a nice play on words.
Oh, that's great.
But there's so much truth to that. No door is unopened. Nothing is unturned. They try any and everything that they can to get the best outcome for every patient that walks through that door. You have patients coming from across the country, all over the world to come to that facility, and everybody is treated with so much respect. As far as the patients that walk through the door, so much respect that it just amazed me. And so they're at the cutting edge of everything that they do there. And I learned so much from that. Sure. Learning, okay, if this didn't do what we expected to do, well, from research or from new innovative steps, what can we do or play off of this to determine what other treatment options may be available for this patient? We may have had 2 patients that have had this, there may be no one that has tried this before. But if this makes sense, let's offer this to this client, to this patient. And if they are willing, we are going to continue to push, to strive to get to what they want to be as the outcome of their treatment. And so I take that into what I do now, right? And so that's why I consider myself kind of, one of the guys that pioneers new treatments here in this area, because I'm not afraid to step out there and do something that's not necessarily, the bread and butter things that we typically do.
I like that about you. The one thing that you said was when it's a gut check, it's a hit to your ego, and I think it's so important that we understand as humans that we are motivated. Some of us are motivated by different things, but as a doctor to actually have your own I don't even know that it's self-worth is the right word for it, but there is a tie to it that your outcome, your patient's outcome,
you're tied to that,
is connected to it, because
Absolutely.
there are how many doctors are there out there that they don't think that way, they don't feel that way, they're not empathic enough to say, hey, I'm tied to how you feel as a patient.
Yeah. And that I relate a lot of things to where I came from. So when I was, first and foremost, when I was in grade school and getting through middle school and heading into high school, my father was diagnosed with lymphoma. and my grandmother was diagnosed with cancer as well. And so I remember those times, being a kid, either being told by a family member that something was going on with my dad or something's going on with my grandmother, and or listening in on the conversations with the medical providers there, and just looking around at everyone in the room and just seeing that that unfortunately half of the information that was being relayed from the medical provider to the family was just kind of over the head. So there wasn't a lot of interaction that was on the same level. And that frustrated me. And it was at that point that I decided that I wanted to be a part of the medical community and make an impact in a way to where I can be on the same level as the individuals. Number one, being empathetic, right? Sitting down, understanding the needs, and trying to find out what I could do to provide those needs, both for the individuals that's going through the medical issue, as well as the family members around them. They're as important as the patient is, because they are the support for that patient. So if the patient, has this planned treatment that's set forth, if he or she doesn't have the support system with them to help them get through these treatments, it's going to be very difficult. But if they have a great support system, their ability to accomplish more is higher. And so I saw that, and that was kind of my first decision making and saying that's when I want to go into medicine. And that carried through obviously when I went into medical school. And then actually while I was in residency program, my mother, I got a call. It was during my first year, which is pretty tough. I just moved out of state and started in residency. Obviously very, very difficult, very challenging, not having a lot of time on your hands. And I got a call from family. My mother just had a heart attack. Healthiest person I ever knew. You couldn't pin her down for anything. She 90 miles an hour always. She was always a go-getter, always the first person there, the last person to leave, and doing things at the school, doing things for for other individuals, doing things at our community church. She was just always there. So first and foremost, she had a heart attack. I was pretty devastated and afraid because I didn't know if she was going to survive it. And then, subsequent to that, getting more information, she ended up, was diagnosed with lupus, which is a very difficult, debilitating rheumatological disorder. And so that was a challenge too, because again, this person who was completely independent now is very dependent.
How can I ask how old she was?
When she was diagnosed, she was in her early 40s.
Wow, young.
Yeah, early mid-40s.
So you kind of see that spectrum of people who think that, hey, okay, so let's talk about how you treat. Do you encourage people to come to be proactive about stuff? Do you have, how many times, if I Google my symptoms, I'm going to think I've got mesothelioma or something like that.
I don't know how many times I have that conversation with patients. Don't Google it. Don't YouTube it.
You'll think you're dying tomorrow.
Don't do it. Don't do it. Yeah.
Okay, so what do you tell people as far as treatments when they start to experience these things? Or is pain management something, is there a certain age? Is there a certain kind of trend you see that, hey, this has got to be on your radar? For men, I moved down here because my father had prostate cancer. And they say for men to go start getting checked at 40. How's pain? How is, because of all this rheumatological and some of the words I was thinking of, is there a certain treatment plan?
Well, that's interesting. As our medical community gets better at what we do, patients are living longer, right? And patients that would have previously died from a stroke, they're not dying any longer. They're living longer. And as a result of that, some of the complications are related to strokes. With weakness on an extremity results in changes in their gait pattern, which then produces potential pain. In their backs and their other joints, and so that causes issues down the line. So we have developed more other medical issues as a result of being able to live longer. That being said, I see the gamut. I see patients as young as 10, 12 years old, on up until 90, 92, 93 years old. Yeah, and some of it is just dependent upon degenerative processes that occur over time. Some of it is, usually if it's a younger kid, it's an injury that occurred related to something they were doing athletics-wise or something.
So
like
you
that.
can see if 10 years. I mean, is there a minimum age that you don't see?
Not really. I would say most of my patients are 15 years and older.
Okay.
Yeah, but usually the large majority are in their 50s.
Got it.
50s,
Got it.
60s.
Okay, so pioneering new treatments. I've seen a news agency, a substantial news agency did a program on you that San Antonio doctors getting patients off of medicine.
Yeah. Oh, you saw that?
Of course I saw that. I see more than people know. Tell me about that. Tell our viewers about that. And hang on a second. Thanks, Rick. Let us know where you're tuning in from. We've got some viewers. If you have any questions for Dr. Jackson, let us know in the comments below. Again, we're live from MOAD, and we are talking to the expert, the authority on pain medicine from Consultants in Pain Medicine, Dr. Shaun Jackson. If you didn't hear the first segment of the interview, I don't know if you're going to go back and watch the live, but Dr. Jackson is seeing close to 100,000 or over 100,000 patients. He's been in practice for 11 years. If you haven't met him face to face, by all means, I mean, now's your chance to get to ask him any questions that you want to, but definitely a market leader, an industry, a pillar, not just in the medical community, but also in the local community. So by all means, let us know. Okay, so pioneering
Yeah, absolutely.
And opioids.
So, again, thank you for allowing me to be here. This is fun.
For sure, that's all we do here is have fun.
So yes, dorsal root ganglion stimulation, that's what that article was about. Neural stimulation has been around in the medical community for 50 years or so. What that technology has allowed us to do is manage individuals that have spinal abnormalities, for the most part, nerve-related injury. The larger majority of the patients that it was initially set up to provide treatments for is individuals who had disc-related problems, spinal-related issues that resulted in nerve damage to their spine. So as a result of that, they developed neck and back pain, which radiated into an extremity, a shoulder, arm, or a low back into the legs. These individuals would usually have spinal decompressive surgery in order to correct the anatomical abnormalities that were there. And in spite of the appropriate surgical treatment, these individuals continue to have nerve damage and nerve-related pain. And so this is what we describe as chronic neuropathic pain. So this device called a neurostimulator was initially utilized specific for this type treatment. Technology has advanced significantly over the past several years, more significantly probably over the past 3 or 5 years. And so this technology is allowing us to do a lot more than we could do previously. So what the device does is it diminishes the hypersensitivity that the patients feel, usually which radiates into the extremities. So because of the, not to get too technical, but the neural stimulations that come from these damaged nerves that travel to the spinal cord and to the brain is producing continuous pain signals. So this device alters that signal and diminishes it so that the patient either feels no pain at all or feels an alternating signal. Previous devices would produce what we describe as massage or vibratory sensation, but now a lot of the newer technology produces what we describe as a sub-perception stimulation, which means you don't feel any stimulation and you don't feel any pain.
Wow.
So that's pretty amazing. Now, a lot of old technology, say if an individual had pain just in their hip or just in their foot from a traumatic injury or from a spinal cord injury, the older devices, you would feel a sensation from your back all the way down to the leg. The DRG devices, the dorsal root ganglion stimulators, allow us to focus on specific nerve roots in the dorsal root ganglion, which allows us to target a specific area in the body. So if we have just foot pain, we can target the nerves that just supply sensation to the foot. Or if you just have shoulder pain, then we can just target that area in the shoulder. And so that's the exciting component to that. These devices last longer because they don't require as much stimulation, as well as, like I mentioned before, the technology is more advanced. Now, this DRG device not only works for chronic neuropathic pain related to injuries related to chronic issues even after you've had spine surgery, but they also were primarily produced for what we call CRPS or RSD, which is reflex sympathetic dystrophy or complex regional pain syndrome. Now, this is a specific syndrome which has been very difficult to treat over the years, and we're still really trying to understand why this occurs. So, an athlete is playing football, running back is running, and is tackled. His knee strikes the helmet of the defensive player. Seems like a fairly minimal trauma, but as a result of that injury, that individual has now developed increased sensitivity along that knee. And even after normal healing should occur, 6 weeks, the pain is still there. 6 months, still there and are progressing. Year out, the individual can't walk on his leg because it's so hypersensitive, and he can't flex or extend the knee because it's that sensitive. With this CRPS, we're understanding that, again, we're having an issue where what we have called ephaptic transmission, where there again is, you turn, just like electricity, you turn a light switch on and you're getting a signal that's going, right? With these types of injuries, it's like cutting a switch on, and there's constantly firing of these nerves saying there's damage here, damage, damage, and all this is running to the spinal cord and then up to the brain to tell you that. When in fact, the injury has healed, but the body doesn't know that, and it's still sending these signals. So this device, the DRG stimulator, specifically focuses in on these areas, targets exactly where those signals transmit to the dorsal root ganglion, then to the spinal cord. So it acts as an amplifier. So I'm a musician, and so you have amplifier basically to increase, decrease sound.
Sure.
Well, if you're able to control that amplifier, you can diminish that signal that's coming from that nerve that's telling you, I'm in pain. So with this DRG device, we're able to reduce that signal at that specific location. So it's pretty cool.
So is this some out of the body, or is it something that you implant?
So you do a trial first.
Okay.
In the trial, you basically place a little catheter wire underneath the skin, and then it's attached to an external generator. And then we usually keep that device in place for 4 to 7 days to assess if that individual is going to be successful with the device. So we typically look for at least 50% reduction in your pain, reduction in use of medication. And we talked about opioids previously. You want to see reduction potentially in their opioid use. We want to see improvement in their functionality. Say that running back, we want to see him be able to walk on that leg. We want to see him be able to extend that knee. And then if he has trouble with resting at night because of the pain, we want to see improvements in that as well. So then in that trial, we sit down and we discuss all of those things. And if he says, okay, wow, you guys hit a home run for me, I can do all those things I wasn't able to do before, I'm not taking as much medication, you're a good candidate for implanting this device. So at the end of that trial, we slide the little catheter leads out, and then we work toward getting the patient set up to get that device implanted internally. And so I describe those devices kind of like pacemakers for damaged nerves, because it's the same type of technology, right? You have a generator, which is a small device that's attached to wires. And so those two components would be implanted underneath the skin.
It's an amazing time, I mean, to be in pain. It really is. I mean, I think about even like maybe my parents, your mom sounds, I'm not sure, I'm not doing the math of how old she would be now, but back, I know when my parents were ill, even before grandparents, like pain was bad. How on the scale of 1 in 10, and you walk into the doctor's office, it's got the smiley face and it's got the frowny face and 10 and the
yes, for better or worse,
pouring tears. How can you alter that when you see people come in on a level 10? Like what sort of results do you see?
With those devices, it's pretty dramatic. I've had several patients come in with the level 10 and we've implanted them, and they're either at not everyone is this way, but
Sure.
I've definitely had several patients leaving with a 0. I would say most of them leave within about a 2 to 4.
2 to 4.
So 50% improvement is better than where they were before. Going from a 10 to a 5, you can be a lot more functional at a 5 than you can be at a 10.
Okay, so let's talk about opioids and how the buzzword right now, opioids, right?
Yeah,
okay, so sometimes it's absolutely must. Pharmaceuticals, finer care through chemistry. I like to say, hey, if it's out there and it's gonna make me feel better, right? But how does Dr. Shaun Jackson use that in his practice to treat his patients? And how does that kind of cocktail of devices and now chemistry, how does that change the scope of the patient's success?
Sure. So it's another tool, in the tool chest, right? To say, based on how this individual is doing, either well or not well with some combination of treatment that we're providing, that this gives me another opportunity to provide them with relief of their issues. So I provide what we would describe as a multidisciplinary approach to care and a holistic approach to care of the patients. We look at their medical problem. We look at the other issues that they have on top of that. We dial down as to the primary focus of the problem. Then we provide a treatment program for that. So, say we have a patient that has had a spinal injury and has had a decompressive surgery for their spine. We would first provide anti-inflammatory medicine to that patient for inflammation. And hope to see improvement of that. If that doesn't improve, physical occupational therapy, those things are important as well to maintain functionality and make improvements in functionality. Because I always talk to the patients about the health of their spine and their overall health. Some of the issues that we deal with, or a large majority of the issues that we deal with that are arthritic, we can't get rid of, but we can help to maintain them as much as we can and minimize their progression later on by focusing in on the things that we can focus in on, which is their health, right? So making sure that they're exercising appropriately. If they're on a good dietary regimen, to minimize weight on their body and stress, which research has shown increased weight on joint structures progresses arthritic conditions. So focusing on those things. If that individual still has issues in spite of those things, then we look at interventional injection type procedures. If they've had surgery and still having pain in the back and leg, then we may look at something like a neurostimulator as an option. And the patient may get 60-70% improvement in their pain with that device. But when they're outside mowing their lawn or baling hay or whatever, they may have 1 or 2 days out of the week where they have more significant pain where the device isn't managing their pain and certain exercises aren't. At that point, then there may be the option to utilize something like a short-acting opioid medication to kind of help them for those brief periods and times. Research has shown that unfortunately, long-term use of opioids doesn't improve their functionality. And unfortunately can have deleterious effects. So it can cause hormonal imbalances, reduction in libido.
Nobody wants that.
No. So I mean, these are significant things, right? And if you think about it, those things lead to depression and individuals that already are at risk for that. So if we can, we want to minimize the use of opioids, but we can't eradicate them altogether. There are individuals that will need them. And it's our job to try to help provide them to those that we can. And at the same time, because it's not necessarily always a challenge in what we want to provide, unfortunately there's a challenge where the other elephant in the room is insurance companies and trying to get things approved. But that's a whole nother story.
Good old insurance companies.
A different interview.
Sure, yes. That's a whole series of interviews right there. Right there.
Yeah.
So speaking of oids and things that end in oids, cannabinoids.
Yes.
How is that? Where are you on?
That's a hot topic right there. That's a hot topic. So there is a lot of research going into cannabinoids right now, and rightly so. We are finding receptors for cannabinoids in multiple areas throughout our body. They're in our brain, they're in our GI tract, they're near joint structures, which means, okay, we can potentially utilize these for various conditions. So the research is being undersought right now. A lot of money is being poured into it, and again, I think rightly so. The difficult thing about them right now is because where we are from the FDA standpoint, there are some limitations in what we can do. So right now, most of the CBD molecules are considered supplements, right? So to some extent, the knock is you don't know what you're going to get in the products that are available on the market currently.
Sure.
And so if and when you want to look to utilize something like that, you want to vet the product.
Sure.
And make sure it has what it says it has in it. and just doing your due diligence from that standpoint. But I do see, and there is growing evidence to potentially show that cannabinoids are going to have a place in providing pain relief for individuals.
And absolutely, you want to consult your expert doctor.
Absolutely, for sure. Yeah.
Yeah, it's so neat when you said, it being in pain from baling hay to mowing the lawn. You do see it. You see from that the simple, facets of life, and then you're on the, like you said, the pacemakers of this almost robotic technology that we're seeing used in medicine and treatment.
Yes.
And so it's so cool to talk to you about, what's happening on that. There's so much. I mean, it's almost overwhelming.
It can be for sure, but it's exciting.
Yeah.
It's very exciting.
Absolutely.
And that's just more for us to be able to offer to patients, that I can go back and say, this individual that I pretty much laid everything out there, and I'm stumped and I'm scratching my head as to what options are available to us. Oh wait, I've gone to a conference 2 weeks ago and hearing about this new treatment, this new neurostimulator, these new regenerative medicine treatment options that are now emerging as options for these patients that previously before did not have any other treatment options available to them. So
Neat. So our viewers, we sometimes get a question. Where do we find Dr. Jackson on a Friday night, on the weekend? Who are you as a person?
It depends. On Thursdays and Fridays, I'm usually running from the hospital, trying to get to my son's baseball practice to see them and try to help out if I can. On Fridays, I'm usually lounging with my wife and kids at home, watching movies. Or
the best place to be, right?
Yep. Just
home in the hustle.
Trying to decompress, and then on Saturdays, I'm back up with my son, taking him out to one of the local facilities to get some batting practice in or something like that.
Awesome.
But there's always stuff to do in life, right? Medicine is a huge part of my life, and that can be a challenge to try to balance it all. But I would say as I've gotten a little older, I'm doing a better job at balancing family and balancing the job as well, because ultimately, my family and my faith come first.
Love it.
And the job is behind that. Not to say, obviously, I don't take care of my patients, because I do. I get into.
You have to have that hierarchy, though.
Yeah. In order for things to work out best for me, and in order for me to provide my best care for my patients, I have to take care of those two things first.
Yeah. Chaos in the home leads to chaos at the office.
That's right. That's right. My family needs me first, and once I've taken care of them adequately, or as much as I hope to.
Mama ain't never happy though, right? That was mama never happy.
Manage them and take care of them, then I can take care of my practice, which is ever growing, and I can't complain about that.
Awesome. How long have you been married?
I've been married will be 14 years.
Wow, 14 years. So you were with her before?
Yeah, before
LSU.
Yeah.
That's amazing. Yeah. And I think that's part of the success. It's because it becomes very grounding, where you can focus, where your nights are spent studying and learning and honing your craft and you just bring a better level of skill and excellence to your Monday morning, to your Thursday, Friday afternoon, ready to get out of the office. You're just that much more committed and you're dedicated to it. So it's cool. I wanted to talk. I mean, we're already short on time here. We've already elapsed 30 minutes, but man, there's so much to talk to you about. You're a musician.
Yes. So I started out playing saxophone, playing alto saxophone in a band several decades ago, and then that kind of morphed into playing drums. Also played a little bit of piano in the middle of that, thanks to some nudging from my mom and my grandfather.
Amen to mom.
My grandfather as well. Love him and miss him. He passed away a few years ago. But they kind of pushed me into music, which has helped me a lot. I love music. I still have a drum set. I haven't played because of the practice. It's sitting up in the corner waiting for me to
begging
play.
For you to play it.
Yeah. So I'm hoping I'll get a chance to play it in the next year. My saxophone I haven't played, but my daughter dusted it off, and she's actually playing it.
Nice.
She's played in the jazz band within the past year, so very proud of her and
that's
excited
awesome.
for her accomplishments. She started off playing clarinet, and she moved up to a bass clarinet and also played the saxophone. And while we were at home in Louisiana several months ago, I can't recall how the conversation came up, but my sister played the flute in band, and so my daughter somehow got it from her, and now it's at the home, and now she kind of doodles on the flute.
That's amazing.
So me and my wife have kind of they've kind of developed. The kids have developed the musical
That's awesome.
kind of thing. So my son is a guitarist. He had his first guitarist recital this past weekend up in Comfort. Had a great time with him out there.
Acoustic, electric?
Electric.
There you
electric.
go.
So his first songs were Three Little Birds by Bob Marley.
And want to see video.
And he also did Come Together, actually a rendition done by Gary Clark Jr.
Wow. How dynamic. That's amazing.
Yeah.
That's amazing. It's so cool. What an honor. Like I said, a lot of stuff we just don't have time to even get to, and I'd love to have you back again on another segment. But that's what our viewers look for, is exactly this, somebody who's, an expert, somebody who has just kept forging through, and by no means, we didn't even get to talk about some of the real struggles about getting there. But, seeing 100,000 patients in the practice, being somebody who is, creating a trend, setting a trend, bucking the trend, using from the very granular elements of your life, the day-to-days of when you're in pain, and how the epidemic of just pain, the pain crisis right now, it's that in itself is overwhelming. But to see the treatments and the almost these DRGs and neurotransmitter things that you're using, to be able to implant and then use that as, like I said, kind of a cocktail of treatments. It's really amazing what you're doing out there in the community. I hear amazing things from the doctors that I know of your reputation. I saw that you have nearly a 5-star rating from almost 60 people online.
Wow.
Yeah. So everybody, you're overall. People love you. People love you, and I can see why. You're a family man. You're focused. Your family faith and your practice. And it's a pleasure. It's an honor. A lot of the questions that we have, we probably won't even. You might not have gotten answered. And again, if you're going to tune in later to the show, by all means, let us know where you're at, and share, and show some love to Dr. Jackson. If you are in pain, it doesn't matter if you are 10 or if you are 90. Absolutely, go see Dr. Jackson at Consultants in Pain Medicine. You've got 3 locations.
Correct. I have an office in the Quarry off Tree Lane Park. We have an office in the Medical Center off Babcock, and we also have an office in the Brownfields off of Landa Street.
Awesome. So you're all over. So there's 3 locations based on where you're at geographically in the San Antonio and surrounding area. There you have it, ladies and gentlemen. Part of being a high performing professional, being a high performing person on the spectrum of success, how you get yourself to a 9. If you're trying to create a business for yourself, if you're looking for how to do it, these are the traits and these are the characteristics of people who do that, who perform very, very, very highly. And you can see it down to the signature of how every single minute of their day is governed by self and governed by a purpose bigger than themselves, which is that story that we're always telling here on XStream. So thanks for tuning in. Show us some love. Thanks for all the support. Thanks for all the views. And we will catch you on a next upcoming episode of XStream. This is Rachel. We'll talk to you soon. Hey guys and gals, this is Rachel. Do you have a business that you're trying to get to the next level but need a little more inspiration? Check this out. We are at MOAD, San Antonio's fastest growing, most exciting workspace. I don't know if you knew, but 2 billion people are virtually employed. So folks, this is not a trend. This is now, and this is the future. If you need all the formal settings of a conference room, workstations, Wi-Fi, free parking with a not so stuffy office feel, consider a membership at a MOAD.